Training Session 2 is composed of two parts. Part 1, Environmental Protections and Prevention, and Part 2, Managing Medications and Daily Treatments. This training series was developed by the University of Southern California University Center for Excellence in Developmental Disabilities by the following team members: Dr. Cecily Betts, Dr. Larry Yin, Fran Goldfarb, and Dr. Olga Solomon. At the end of this training, you will learn and apply the CDC recommendations for skilled nursing and congregate facilities, learn the preventive measures to employ and prevent the spread of COVID-19, be prepared to assist with the development of a household plan, and understand the procedures needed for administering medications and treatments. Part 1, Environmental Protections and Prevention. The CDC recommendations for group homes for COVID-19 prevention include: actively monitor all individuals for illness symptoms, restrict all visitors, no group social activities, no group dining, and social distancing enforced. Other recommendations for group settings include: place hand sanitizer in each client's room, ensure adequate supply of soap and paper towels for hand washing, do not share towels to dry hands, and the staff should wear masks if there is an outbreak in the community and a client has symptoms of COVID-19 in the facility. Preventive measures to take: institute daily and frequent routine for cleaning services using the Environmental Protection Agency or EPA registered disinfectants and products instructions for tabletops, doorknobs, light switches, handrails, toilet seats, sinks, and counters. Here are guidelines for cleaning hard surfaces. First of all, wear gloves. Discard disposable gloves after cleaning. And if you look to the right of the slide, you will see a graphic that demonstrates how to remove gloves, which is available on the Centers for Disease Control website. It gives you a step-by-step procedure for removing gloves properly. If gloves are reusable, only used for COVID-19 purposes, clean the gloves after each use. Follow the manufacturer's instructions. Wash hands immediately after removing gloves. Use disinfectants. Refer to the current Environmental Protection Agency list or EPA list for those disinfectants that are effective in using against COVID-19. For cleaning porous surfaces, examples of porous cloth and spongy surfaces are rugs, curtains. Always wear gloves while cleaning. Use the warmest water temperature. Use the EPA approved products. And again, refer to the current EPA list at the website address on this slide. Laundering. Wear gloves when handling the laundry. If gloves are not available, wash hands thoroughly with soap and water. Do the laundry with the warmest water temperature and according to clothing and laundry directions. If a person is at risk or ill with COVID-19, The laundry can be washed with the laundry of other non-affected people. Use disposable bags for collecting laundry that can be discarded. Ensure necessary supplies are available. That means batteries for flashlights and gadgets, disinfectant wipes, hand sanitizer with 60 to 80% alcohol, hand soap, preferably liquid soap, and tissues. If a client is ill, symptomatic, or has tested positive for COVID-19, this client should be isolated in their room alone, wear a mask when the caretaker is in the room, use disposable plates, utensils, and dispose of them in a lined container in the room. And the client should not be touching pets. Other members of the household can provide pet care. For a client who is ill, symptomatic, or tested positive for COVID-19, that client should be restricted from susceptible providers and non-essential visitors, be restricted from family members and friends, but can and should do video calls. That client should be assessed if symptoms worsen. The staff should call the healthcare provider for an appointment if symptoms worsen, as the office will need to implement measures to protect others in the office. The healthcare provider will need to call the public health department to report and for other guidance. If a client is or may be COVID-19 positive, providers and staff should don a mask upon entry into the client's room, wear a mask throughout the day, wear gloves when touching the ill person, dispose of gloves and the mask in a lined container, and wash hands with soap for 20 seconds after first taking off gloves, then washing the hands, then removing the mask, and then washing the hands again. If a client is or may be COVID-19 positive, to reduce spreading to others in the home, avoid all sharing of daily household items such as glasses and plates. Have other members use separate rooms and bathroom. Have a good airflow. Use an air conditioner and open windows. Clean hard surfaces with disinfectant, wearing gloves multiple times each day, and give special attention to the room of the ill individual. Dispose of trash from the ill person's room in a disposable bag that has been tied closed in the outside trash cans. Also, to reduce spreading to others in the home, if there is blood, vomit, urine, or other bodily fluids on sheets or clothing, remove immediately and wash. Be sure to wear gloves. Wash items according to directions using the highest water temperature, and guard against having these contaminated items touch the body while cleaning. A household plan is recommended should an outbreak occur in the individual's community. Communicate with stakeholders to develop a plan if and when an outbreak occurs. That includes assigning tasks to undertake, identifying resources available, list and obtain resources needed, and identify those at high risk for COVID-19. A household plan should include a list of nearby community resources that consists of the following: healthcare services, their hours, telehealth options, testing and treatment available, pharmacies, their hours and online services available, grocery stores, food banks, their hours and delivery options, mental health services and resources, whether telehealth and in-person services are available, vendors for supplies and equipment needs and repairs, and home delivery services for food, supplies, and equipment. A household plan should also include a list of contacts for emergency purposes. That includes contact information for family and friends, contact information needed for staffing, transportation options that may be needed, such as for drivers, local emergency departments, urgent care, and contact information of healthcare providers. Part 2, managing medications and daily treatments safely. Prioritization of tasks. Are there any tasks that can be done remotely using the phone or other technology? And these examples would include delivery of food, prompting for activities of daily living such as bathing and eating, but that's done only if the individual is able to typically engage in these ADLs, laundering, shopping, obtaining supplies, equipment, and taking of medication independently. Managing medications and daily treatment safety includes the following. When administration of medications or performing a treatment is needed, the following precautions need to be done. First, determine if the individual has COVID-19 or is a person with respiratory symptoms. If so, the person needs to wear a mask, or if unable, the staff person needs to wear a mask. Disinfect the surface of where medications are ready for administration at least twice per each shift. When administration of medications is needed, the following precautions are needed. Wear gloves when disinfecting the surface, change the gloves after disinfecting, and then wash hands. Wear gloves when preparing meds and administering medications. And after administering medications, take off the gloves, dispose of the gloves, and wash hands. And you can refer to the previous graphic as to the proper steps to take in removing gloves. Also, when administration of medications is needed, the following precautions are recommended. Assign one individual to provide medication during a shift. When the individual is providing medications, the individual must be left alone during this task. Change gloves with each individual after providing medication and maintain a social distance of 6 feet. When administration of medications is needed, the following precautions are recommended. Each client should have a medication log. And there's an example on the next slide. Be sure to abide by the 7 rights of medication administration. The right client, the right medication, the right dose, the right route, the right time, the right reason, and the right documentation. Here's an example of a medication tracking sheet that you might want to apply in your own setting. This is a list of references that were used in putting this training session together. And as well, you may want to consult these sites at a later date.